Hello, I'm Ohio Governor Mike DeWine, and welcome to the first virtual statewide Medicare open enrollment town hall. We want to make sure you get the Medicare insurance coverage that you need. Navigating Medicare can be sometimes confusing. So our team is happy to help you navigate and choose what's best for your healthcare needs and your budget. Today you'll hear from the Ohio Department of Insurance Director Judith French, Ohio Senior Health Insurance Information Program Director Chris Gregg, and a variety of Medicare experts. This team is ready to answer your questions. If you're nearing age 65, or if you're already 65 and you now receive Medicare, it's time to review your plan and your coverage options. The open enrollment period runs through December 7th. So I encourage you to stay tuned, ask questions, and get the help you need from our Medicare experts. With that, I'm going to turn it over to Director French.
Well, thank you, Governor DeWine, and thanks to all of you for attending, as the governor said, our first ever Medicare open enrollment town hall. I'm Judy French. I'm the director of the Ohio Department of Insurance, and we are so happy that you could join us today to talk about the Ohio Senior Health Insurance Information Program, or OSHIP, and Medicare insurance coverage. So before I turn the floor over to the director, Chris Gregg, I want to tell you a little bit about the program itself. OSHIP is a nationally recognized senior health insurance information program that has counseled more than 400,000 Ohioans and saved Ohio consumers more than $32 million. The program's mission is to provide free and objective health insurance information to Ohioans who are Medicare eligible, beneficiaries, and their caregivers. They do this through a variety of methods. There's a hotline, we have one-on-one counseling, we have year-round in-person and virtual outreach events, and we have open enrollment and welcome to Medicare webinars. And while we have a number of full-time staff to carry out these duties, without our volunteers, OSHIP could not fulfill its mission. We have wonderful, dedicated volunteers across the state that go through training and help people in their own communities right alongside the OSHIP community liaison for their area. So for more information on counseling, events, and how to become a volunteer, visit our website, insurance.ohio.gov. Now let's jump into Medicare open enrollment information. Chris Gregg has been with OSHIP for more than 23 years and has been the director since 2012. She is a wonderful asset to the department and to all of those Ohioans she has served so well. She's going to discuss Medicare benefits and plan options. So Chris, please take it away.
Thank you, Director French, for that wonderful overview of our OSHIP program. Give me one moment. I will share the PowerPoint for this evening's presentation. There we go. So today we'll be going over kind of some high-level information about Medicare, what you need to be doing during this Medicare open enrollment, some cost savings plans, and some tips to avoid some fraud and scams that go on during this time of year. So let's start with, what is Medicare? Medicare is healthcare, plain and simple. Health insurance that's provided by the federal government through CMS, which is the Centers for Medicare and Medicaid Services, for individuals that are 65 and older, any age and disabled, and those diagnosed with end-stage renal failure. So if you're eligible for the Medicare benefit, you can see on this slide, there's actually two options, very general options. But option one, you're in original Medicare. That's Medicare Part A, Medicare Part B, that red, white, and blue card from the federal government. Option two is to join a Medicare Advantage plan, or Part C for choice. You're choosing to get all your Medicare benefits from that private company. So the first thing we're going to do is go through the difference between these two options. and then what you need to do during this time frame to make sure you are in the right option for you as an individual. Let's start with option 1. You notice there's more than one box. We said option 1 is getting your benefit from original Medicare Part A and Part B, your red, white, and blue Medicare card. So Medicare Part A is your hospital insurance, but really it pays the places. Medicare Part A covers inpatient hospitalization, inpatient skilled nursing care, some home health and hospice. Most of you do not pay a premium for Medicare Part A. You are entitled to it because you paid into that Medicare tax all your working life, or a spouse has paid into that tax. So Part A is generally premium free. Medicare Part B is your medical insurance. It covers all of the providers, practitioners, all outpatient services, ambulance, and preventive benefits all fall under the Medicare Part B. So A and B work together to cover the majority of your health care coverage. As many of you know, there is a premium to Medicare Part B, and that you pay regardless of which option you choose. Medicare Part A and B also have other out-of-pocket costs, deductibles, copays, and co-insurance. So if your only form of insurance is through original Medicare, you would be paying those out of pocket. Many individuals have what's called secondary coverage, something paying after original Medicare. For some, they may have a group health plan from a previous employer. Others may qualify for Medicaid, which is the assistance for those with limited income and limited resources. But generally, when we talk about secondary coverage, we are referring to MedSup, or Medicare Supplemental Insurance. This is private insurance that you can purchase through a company to pay after Medicare A and B. These plans are standardized, and the enrollment does not fall during this fall open enrollment. So some individuals may have a supplemental insurance plan that they plan to stick with for the rest of their lives. But we still encourage folks to review the coverage they have and the coverage they might want for next year. Option 1 also has a third box there, or a third card in your wallet, if you will, and that is for prescription drug coverage. Again, some individuals may have prescription drug coverage available to them from the VA or from a group health plan with an employer. But most Medicare beneficiaries, in order to have prescription drug coverage, are seeking a Medicare Part D, as in drug, plan. These are standalone programs, 23 next year to choose from, that cover prescription medication in all categories. So option 1, original Medicare is your primary payer. You may have a second card in your wallet to help pick up the cost that original Medicare doesn't cover. But then typically you're shopping for prescription drug coverage every year. Medicare Part D plans are on a 1-year contract with Medicare. That's why it's so important that we review these plan options every year during this time. The alternative to option 1 is Medicare Advantage, or Part C. I believe I said earlier, the C is for choice. You can choose to get all of your Medicare benefits from a managed care plan. These plans must, at minimum, cover what original Medicare would pay for, and some offer additional benefits as an enticement for enrollment. To be eligible for a Medicare Advantage plan as your option, you must be enrolled in both Medicare Part A and Part B. Second, you must live within the plan's service area. Medicare Advantage plans also contract every year with the federal government. They decide if they're going to stay, if they're going to go, what their cost structure is going to look like, what the additional benefits are going to look like, and that is county by county. So don't fret, every county in Ohio has a multitude of options out there, but you are limited based on the county that you reside in. Third, there are no age or medical restrictions. That can be a benefit. So no medical underwriting. As long as I'm enrolled in Medicare A and B, I live in the plan's county that they are servicing, They have to accept my application. They can't say, oh, sorry, you're diabetic, you've had a previous history of cancer. They have to accept my application. Again, this is an alternative to original Medicare. So often, Medicare Advantage plans are confused with Medicare supplemental insurance policies. Remember, supplements pay after original Medicare, Part A and Part B. The Advantage plan replaces both your need for using Medicare A and B and the secondary insurance, and they typically include the prescription drug plan. So a benefit is you're carrying one card in your wallet. We're often asked, what is the advantage to Advantage? And it really comes down to evaluating the coverage, the cost, and the convenience. With original Medicare and a supplement, you don't have a network. You can go to any doctor in the country that sees Medicare patients and they will cover that. With Medicare Advantage, most of the plans are managed care. So they have a network of doctors and hospitals and other providers. And if you use those in-network physicians and providers, you're getting the most benefit from that plan. In fact, the most common types offered are an HMO, a health maintenance organization. That is a type of managed care plan that requires you to use their network providers or they will not pay. A PPO, or preferred provider organization, prefers you use their providers. You'll have lower co-payments using in-network services. However, PPOs do allow you to go outside of the network for service, but you would have higher out-of-pocket costs. Again, these include the Medicare Part D benefit. So you also want to evaluate to make sure that the plan covers your prescription drugs, at what copay cost, and what pharmacies are also in network. That is a very high level overview of the two options that are out there. So what is it that we're asking folks to do during this Medicare open enrollment, which again, October 15th to December 7th. So as of Friday, we're in open enrollment. This is the first full week of open enrollment this year. We're asking that all Medicare patients review their health and drug coverage. So if you're on the phone as a Medicare patient yourself, or perhaps you're helping your parents or other loved ones with this process, the starting point is knowing what type of coverage you currently have and how is that working for you. And then if you need or want to make any changes, you need to do so by December 7th. Those plan options will go into effect January 1st, and then ideally you're in the proper plan for that year. So I talked about a starting place. By now, you should have received your annual notice of change, or ANOC, because we like our acronyms, which is from your prescription drug plan or your Advantage plan, an overview of how that plan is changing for the upcoming year. We have had plans with a steep increase in pricing. If you got a prescription drug annual notice of change and your monthly premium is quadrupling next year, that is probably a huge red light saying, well, let's review what these plan options are. I likely need to find a different drug plan for next year. Well, how do we compare all these plans? You know, I know we went over it briefly, but you have original Medicare, you have standardized supplement plans, 23 drug plans, and a multitude of Advantage plans. The one place to compare all of these plan options is on Medicare.gov. The GOV is important to know that you're on the government site. They have a plan finder tool that allows you to enter in all your prescription drugs that you're taking, the milligram strength, the dosage, and it takes the drug plans and even the drug coverage in the Advantage plans and puts them from the least expensive to the most. That really helps us narrow down these plan options. But there's always more to consider. First and foremost, Medicare, or the Centers for Medicare and Medicaid Services, is very blunt in telling us that that plan finder is an estimation of costs. Costs can fluctuate like the market, so we could see a soft increase or decrease when you're paying those copays at the pharmacy. So while we're early on in this Medicare open enrollment, if we narrow it down to a specific plan you feel is best for you, we highly encourage you to contact the plan directly, confirm those costs to make sure that their information and data they provided to the federal government is correct, and that's what the cost will be when you are at the pharmacy. Additionally, Medicare.gov gives us extensive information about Medicare Advantage plans and the out-of-pocket costs for all health. This is the time of year your mailbox, your inbox, your phone is probably ringing off the hook with marketing of Medicare, typically the Medicare Advantage type plans. So how can you discern that you're looking at the right option? We encourage you to use OSHIP, use Medicare.gov as an objective, unbiased source. Before talking to the plans or the agents directly, we're here to help and provide that information and the best guidance that we can in selecting these plans. Again, Medicare Part D plans, Medicare Advantage plans are on a one-year contract with Medicare. So this is the time of year to see what is changing for 2022. Few other things before we open it up for questions during this time. There is assistance out there. We're often told by Medicare patients and their caregivers and their family members, they just can't afford it. They can't afford the out-of-pocket costs with these plans. So first of all, we do want to make sure that we help you find the most cost-effective plan that meets your needs. You'll see a lot of advertisement for zero or free plans out there. I caution that doesn't mean they're free. There's no additional monthly premium, but they do have copays for out-of-pocket services and restrictions. So we review that. But beyond finding the most cost-effective plan, there are programs available to help pay if you have limited income and limited resources. First, under Medicare Savings programs, there are Medicaid programs called Medicare Savings programs that help pay your out-of-pocket costs with Medicare. So it could be a program that simply pays the Medicare Part B premium to a plan that pays everything after Medicare. We have shared the income and the resource guidelines. I encourage anyone that is close to these income and resource guidelines, check it out. Our motto is, when in doubt, fill it out. The worst that Medicaid would do is say, sorry, you don't qualify for these programs. You have too much income, too much resources. You know, we can always look into that and appeal if necessary, but you don't know if you don't ask. And secondly, what more folks qualify is for the Medicare Part D extra help or low income subsidy. This isn't Medicaid, this is Medicare, just helping pay the out-of-pocket costs for prescription drugs. The income and the resource amounts are much higher than any Medicaid program, and we still know there's thousands upon thousands of Medicare patients in Ohio that would qualify for this extra help that on average saves over $4,000 each year. So again, we'll happily assist you in screening to see if you qualify for these programs. And finally, as the curtain opens, we do ask that you protect yourself against Medicare fraud. Because this is the time, Ohio has over 2.3 million Medicare beneficiaries. And this is the time that everybody's making their choices. There is added confusion due to the heavy marketing and the many plan options that are out there. And that is just a breeding ground for unscrupulous activity. So we encourage you, first and foremost, report it. If you think something's fishy, let us know. But a few things that happen that shouldn't. No one should be going door to door. And they certainly shouldn't be showing up at your doorstep representing Medicare. Medicare is not going door to door. Medicare is not calling you. These are typically out-of-state broker firms that are trying to sell you a product. Companies cannot give out cash gifts or any gift that exceeds $15 in value. So if somebody's offering you a plasma TV, I don't even know if that's the most up to date anymore, but a big ticket item for signing up for their plan, that is not proper activity. We do hear a lot of high pressure sales tactics. No one should make you feel pressured into signing up for any insurance product. They should not misrepresent the call. If you have a legitimate appointment with an agent to talk about Medicare Advantage plans, that conversation should not be branching out into annuities or other insurance products. They have to remain within the scope of that appointment. And lastly, and again, no one should be representing themselves as a Medicare, as a government official. Medicare is not contacting beneficiaries directly during open enrollment or any other time during the year. At the top of this screen, you do have the number for our fraud and enforcement. They oversee agent activity in the state of Ohio. And you also have the contact for Pro Seniors. They are contracted with Medicare to be our Senior Medicare Patrol, or SMP. So they want to report, detect, report, and hopefully end or at least curtail Medicare fraud and abuse. So with that, we have one last screen. As Director French shared with you, OSHIP is here to help as your objective, unbiased source for Medicare information. We have a plethora of ways that you can reach out to us. We're working on a hybrid situation right now, so we do have some in-person events, and that list is available on our website, insurance.ohio.gov. But we know during this time of uncertainty, we are continuing to offer webinars. So we do offer a weekly webinar throughout the Medicare open enrollment to go into further depth on all the things that I've touched on tonight. We offer both in-person and virtual one-on-one counseling. And then our director also mentioned our wonderful volunteers throughout the state of Ohio that are certified to help you as the local face of OSHIP. And last but certainly not least, our hotline staff, 800-686-1578. We're available Monday through Friday, 7:30 a.m. to 5 o'clock p.m. to assist you. So we also have with us tonight Becky Hayward, who is our volunteer ombudsman, and she's going to help communicate your questions. So we hopefully give you lots of answers this evening.
Great. I will get started, Chris. So what if I haven't done anything every year? I've had Medicare for a long time. Do I have to renew my Part D every year?
Oh, excellent question. No, if you do nothing, we've always said doing nothing during Medicare open enrollment is also a choice. And essentially, you're choosing to stay in the plan that you have. So if you have Medicare supplement and the Part D plan that is renewing next year, you'll be in that plan come 2022. Same if you're in a Medicare Advantage plan. If you do nothing and that plan is returning next year, you'll remain in that Medicare Advantage plan. Why we encourage folks to review so often, I'm going to use Medicare Part D as an example. You know, we just helped someone this morning. They had a standalone prescription drug plan that they had not reviewed for years upon years. The premium for the drug plan alone was up to almost $100 a month. After reviewing their plan options and selecting a different Part D plan, they're saving over $3,800 in 2022. So it is a significant cost savings.
Okay, when you talk about resources for our extra help programs, what are you referring to?
Yeah, so for Medicare resources, I'm going to skip ahead to that slide. Bear with all my transitions, just so you can visualize what we're talking about. We didn't have too many slides, so it's easy to navigate. Okay, first of all, for the Medicare Savings programs, I mentioned that those were Medicaid programs. So they go through the same type of scrutiny to make sure you qualify as full Medicaid. So income is going to be anything that you're collecting monthly: Social Security income, employer income, child support, anything coming in monthly. When we talk about resources, it's money in the bank or anything that you could turn into cash that is a liquid asset. So certainly your savings account, your checking account, your stocks, your bonds, mutual funds, IRAs. Again, anything that you can, if you can get money in your hot little hand, it's going to be counted as a resource. So if you know of someone that is close to these income and resource limits, I would encourage them to reach out to their county job and family service office to apply to see if they qualify. And then they can work with that county to see, if they fell above or below those resource guidelines, what was holding them back. With regards to Medicare Part D, I mentioned that is not Medicaid. This is Medicare. So Social Security is the determining factor based on your income. They verify your income using their records as well as a financial data match with other institutions. And again, resources would be money in your bank, savings, checking, stocks, bonds, and other annuities that are in the banks.
Great, thank you. So is there still a donut hole when we talk about Part D plans? I thought that went away.
Yeah, it kind of did, and I agree with you. So when we talk about Medicare Part D, there are out-of-pocket costs. And I'm going to go back specifically to kind of these standalone prescription drug plans, or even the drug plan that's part of the Advantage plan. There are out-of-pocket costs. So for many of them, you do pay a monthly premium just to have the insurance. Many of them have an annual deductible, so money you would pay for your prescriptions before the plan kicks in. Then we typically see tiered copays. So if you have a generic, it might be a low or zero copay when you pick up that prescription drug, whereas a preferred brand name medication could be a $10, $20 copay. But you pay those copays until you reach a threshold. And that used to be called the donut hole. But we had a previous law that got rid of the donut hole. However, we still see a slight increase in costs. So whether we call it the donut hole, we call it a coverage gap, we call it whatever, it is possible that your prescription drug costs will increase during the course of the calendar year. And that again speaks to the point why it's so important to review these drug plans. If you or we or Medicare enters in your prescription drugs, ideally we can see when you're going to meet your deductible, how long you're going to pay the copays, and approximately what month would you have those higher out-of-pocket costs. And to continue on that path, there's also an out-of-pocket max there. Once your total drug cost hits a catastrophic mark, you would only pay 5% for the remainder of that calendar year. Good question about that coverage gap. But yeah, prices can increase throughout the course of the year.
Okay, thank you. So if I have original Medicare and a supplemental plan F, I have a plan F now, which is potentially going to increase in price since they're not sold anymore. You can address that. Can I change perhaps then to less coverage, like a plan G, without going through medical underwriting?
Oh, possibly. So, okay, great question. So we have an individual in option 1, original Medicare, with a private Medicare supplement plan F. I mentioned that secondary or MedSup is standardized, and because we like the alphabet, we use letters to identify them. F happens to be a plan that covers virtually everything after original Medicare pays first. Those plans are no longer sold to folks who are new to Medicare. They don't have the C and the F option. So if you have it, you can keep it, but you have to continue to pay that pretty high monthly premium. And then, of course, you still have to get the prescription drug coverage in addition to that. So can I go to a lesser Medicare supplement? Generally, yes. I would talk to the company first, because typically if you go to a lesser Medicare supplement within the same company, they will not go through medical underwriting. However, if you are shopping for a supplemental policy with another company, they will medically underwrite that policy. MedSups will almost always underwrite their policies. When you first turn 65, you have a 6-month window to get any supplement that you want. Outside of that, there are a few guaranteed issue situations where if you were to lose your insurance through no fault of your own, they would have to sell regardless of medical underwriting. But generally speaking, anytime you are shopping for Medicare supplement insurance, they will medically underwrite.
All right. Quite a few questions here about Medicare Advantage plan options. So how you choose for one, how do you know that you can compare costs? I mean, we know we can compare drug costs with Part D, but is there a way to compare Medicare Advantage costs by picking specific information so that you know Medicare Advantage works or how the plans work? And then specifically, so how can you have a Medicare Advantage plan that doesn't have zero premium? So they promote that there's no cost to you, which there's no way that's true, right?
Right. Yeah, I agree. Medicare Advantage comparison shopping is much more difficult. With supplements, they're standardized. We're kind of comparing apples to apples. If the previous question was looking at Plan Fs, it's the same benefit structure regardless of the company. With Advantage plans, it's very different. And I know, here in Franklin County, we have like 60 Medicare Advantage options. Cleveland, Cuyahoga County has even more options. How do you start to whittle that down? Because we can use the prescription drug benefit as one means. Maybe we find a few plans that are the most cost effective for our prescription drugs. But beyond that, how do we find the details? And again, we use Medicare.gov, the plan finder, because it is the one location that has all of the plans listed out there. And you mentioned the zero premium. The commercials are overwhelming this time of year. And zero premium does not mean zero out of pocket. So what we're going to do in the plan finder is look at, okay, we know it's a zero premium above the Medicare Part B premium, but what are the copays? You might also see advertisements for no copay for your primary care physician or no out of pocket for preventive benefits. But you need to know what those copays are should you need, let's say, inpatient hospitalization. That typically, it could be 100 or more per day copayment that you're responsible for out of your pocket. Now, I will state Medicare Advantage plans do have to have a maximum out of pocket. So it could be $3,000, it could be $10,000, but that's almost your the biggest financial risk. So if you're healthy, you're in this plan, you think, okay, I can take it. Next year, if you had the worst year of health ever, and you incurred several of these copays, that maximum out of pocket is going to be the worst case scenario for out of pocket costs with the Advantage plan. The other thing that I would stress highly with Advantage plans, a lot of folks want to choose their Advantage plan based on the goodies. Beyond this Medicare coverage, what am I going to get? Can I get some vision, dental, gym memberships? That's a big one. Money, cash to spend at the local pharmacy. I would not encourage anyone to choose their health coverage based on the goodies, but even the goodies will have restrictions. So start shopping early in the Medicare open enrollment plan. If you've narrowed it down to one Advantage plan, call them directly. I'll use dental as an example. We've seen flyers that say, oh, all your dental needs are covered. I can guarantee you, if you need a crown or extensive dental work, it's not included in that added dental benefit. So knowing all possible out-of-pocket costs, knowing the network restrictions, who's in network, who's not, and knowing what the specifics are for those added benefits before you sign up, usually mean using the plan in the upcoming year works well because you're not blindsided by costs or restrictions.
Okay, so now we're seeing plans that are advertising that they give you money back for your Part B premium.
Yeah, it's the Wild West with added benefits. But that's a wonderful thing. I can see why that's an enticement. And it's listed on Medicare's Plan Finder, so we know that that is a benefit. But again, we have to contact those plans directly to find out what extent, if they're paying the full Medicare Part B premium, or if they're paying a portion of it, because that's an arrangement they've made with Social Security, so that amount of money is not taken out of the check.
Again, an extra benefit. So you want to look at all the costs before you get there.
Look at all the costs and the network restrictions. I should point out also the network restrictions, you want to know what providers you can go to in an Advantage plan, but their contracts could be up mid-year. So where you're basically locked into this Medicare Advantage plan for all of 2022, in June, a provider, could choose to leave that network. So by joining a Medicare Advantage plan, again, you're choosing to get all your benefits from that plan. And in doing so, you're agreeing to their out-of-pocket costs. You're agreeing to use their network providers, which could change, and you're utilizing your drug benefit from that company as well.
I have multiple questions here about, do I need Part D? So do I need Part D if I have just Part A? Do I need Part D if I don't take any meds? Do I need Part D if I have something else for prescription drugs? And then on that side note, is there a penalty if I don't take Part D?
Yeah. So just like Medicare Part B, nobody is going to force your hand to take it. However, we find in most cases it is most beneficial to take both Medicare Part B as in boy, if you're no longer working, and D is very similar. So do I need the drug plan? If you are in Medicare A and or B, you would need Medicare Part D as in drug if you want to avoid a penalty later. The exception to that is if you have prescription drug coverage that is equal to or better, you would not have to take a Medicare Part D plan and there would not be a penalty later. So if let's say I'm still working. Let's start with that example. That comes up a lot. I am still working and I am turning 65. What do I need to do? Well, I can go ahead and take Part A. I'm entitled to that. There's no monthly premium. But I have an employer group health plan from my current job. So I could delay taking Medicare Part B as in boy until I retire. Medicare Part D, if that employer plan is offering me prescription drug coverage, which is likely as part of my employment plan, I would not need to take Part D at that time. But let's say 5 years goes by and now I am ready to retire. Well, first thing I'm going to need to do is pick up Part B. If I know I'm retiring in June of that year, I should go to Social Security in May and tell them I'm ready to pick up that Medicare Part B. I actually have 8 months after, but it's better to be proactive. Now, what do I do about the drug coverage? All right, when I'm ready for B, I'm ready for D. And if I no longer have a drug benefit that is equal to or better what Medicare is offering, I would need to enroll in Medicare Part D. Otherwise, there would be a penalty for late enrollment. So I can join any year during this fall open enrollment, but Medicare would assess a 1% penalty for every month that I had delayed. So we don't like seeing folks get stuck with a Medicare Part D prescription drug penalty, or Part B for that matter. So please, these are generalizations and answers. Please contact us directly so we can review your specific situation. What coverage do you have to see if you can avoid a penalty or if you need to take the Part D. We also talk to a lot of veterans who have prescription drug coverage through the VA. That VA prescription drug benefit is equal to, it's better than Part D. So many veterans don't currently have a prescription drug plan unless they're having, maybe some difficulties getting the drugs through the VA, and they want the option to go to the local pharmacy. So some generalizations, but I do encourage everyone to look at your situation specifically to see if it applies to you.
So this coming year, I looked at my annual notice of change, and my drug plan changed one of my drugs to a higher tier. Is that something that's common?
I wouldn't say common, but not out of the ordinary, if that makes sense. First of all, reading that annual notice of coverage is huge, and not many people do. Not many folks take the time. And when we talk about a tiered copay, we're going back to those Medicare Part D out-of-pocket costs where you may have a premium, you may have a deductible to meet, but then you're paying copays. those copays are tiered. You know, tier 1 is typically preferred generics. Tier 2 might be preferred brands. Tier 3, non-preferred brand. And as you go up those tiers, the copay is higher. So you may have had a brand name medication that your plan had tiered 1 along with generic medications. And now next year, maybe it's even going up to tier 3. Knowing that ahead of time, again, is kind of giving you the signal. Let's review and see what other Medicare Part D plans are out there. And could I potentially save money by switching plans? Yeah, I wouldn't say it's uncommon, but every year plans change. And that's why it's imperative to review.
Agreed. That's an example of how they change, not just in premium, but where your tiers are. Yep. So we know that there's a rather large COLA for next year, almost 6%. Do we have any idea how that might affect somebody's Medicaid or their extra help?
Well, actually, with the cost of living adjustment, Medicaid will generally update based on the federal poverty level, and we'll see those applications change in March. But what I will share with what most everyone's probably thinking is that your Part B premium will go up. The cost of living adjustment and the Medicare Part B premium are actually tethered by law. So we see a lot of comments like, oh, I'm getting the cost of living, but I'm going to see an increase in Medicare. And yes, you will, because they're actually tethered by law. So CMS, and I know, Becky, you're the newsie, it may have come out while I was talking, but to my knowledge, the federal government has not released the original Medicare out-of-pocket cost as of yet.
No, we generally hear it on the news in the morning. So
That's
we've
true.
already discussed about how the dental and eye and hearing vision or hearing benefit that might be in a Medicare Advantage. You discussed how it's not particularly comprehensive. How would somebody get that type of insurance if they didn't get it from their Medicare Advantage?
Yeah, there's very minimal options. So generally speaking, you know, we've got about 40% of our Medicare population on Advantage plans with these added benefits. Others, you know, if you have, I'm going back to the option 1, if you have a secondary insurance, a Medicare supplement policy, that company also might offer a rider to that supplement to cover dental, vision, but it really is a separate policy. Medicare supplement plans are standardized. They have to offer the same benefits across the board, and it only pays after original Medicare, but they may use that opportunity to sell almost an additional policy, if you will, to cover prescription and dental. But it is few and far between in getting coverage for those types of benefits outside of an Advantage plan. I do want to stress, you know, if we have others that are newer to understanding Medicare, bear in mind, if you have been diagnosed with eye disease or diagnosed with a medical condition, Medicare, original Medicare, and your medical benefit under the Advantage plan must cover those diagnosed situations, anything that's medically necessary. So what we're typically talking about with these added benefits is really routine services. You know, Medicare won't cover a routine cleaning or a routine eye exam or a routine hearing exam. So these added benefits come in really for routine and non-medically necessary services.
So I have a Medicare Advantage plan, and I've had it for several years. Okay, the plan non-renews, it goes away. Does that qualify me for a special enrollment with no underwriting to get back into original Medicare and a supplement?
It does. I mentioned earlier, there are some situations called guaranteed issue opportunities that if you lose your health insurance through no fault of your own, you would have guaranteed issue to a supplement. So kind of going back to this option 1, if you're here in this Medicare Advantage plan and their contract is good for 1 year, and your Advantage plan decides we're not coming back, you should have received written notice early in October that they're not coming back. The letter should have outlined some of your options. So you can always go to a different Medicare Advantage plan. But if you choose to go back to original Medicare for January 1, you would have guaranteed issue rights to purchase a Medicare supplement plan, any company that's selling in the state of Ohio, For plans A, B, CF, if you've been on Medicare for so many years, that would apply also, and K and L. And I know those letters mean nothing that I'm spewing out, other than it's not every single Medicare supplement plan out there. I would encourage you to give our office a call and we can look at those options. Another thing that we can do, it's not on Plan Finder because this isn't Medicare, but we do have a database that allows us to search for Medicare supplemental insurance premiums and help you kind of narrow down the scope of shopping for those plans too.
Great. So about 15 minutes or so here. A couple new to Medicare questions. Remind folks we have a Welcome to Medicare webinar tomorrow at 4. When does Medicare start? The month of my 65th birthday? Later? When does it start?
Well, welcome to Medicare. Medicare, we're on the right slide here. If you are aging into Medicare at the age of 65, if you're already collecting some type of Social Security income, your Medicare benefit will begin the first day of your birth month, and your card should arrive automatically. If you are not collecting any Social Security income, maybe you're waiting, the income, you get a little higher if you wait till 67, you would have to apply through Social Security. Easiest way to do it is socialsecurity.gov. You would want to apply the 3 months prior to your 65th birthday, so coverage begins the first day of your birth month. You have a 7-month window, but the longer you wait in that 7-month window, the longer it takes for your Medicare benefits to start. So we encourage those that are turning 65, make sure your Medicare enrollment is taken care of 3 months prior to your birth month. If you're under 65 and you're on Medicare due to disability, generally it's because you've collected Social Security disability, and after 2 years of Social Security disability, you'll automatically be enrolled into Medicare. If you're diagnosed with end-stage renal failure, you would have to apply with that diagnosis, also socialsecurity.gov.
Great.
And Becky, I will reiterate Becky's plug. We have dedicated webinars for those that are new to Medicare. And Becky, if you want to share that info one more time, folks can find it on the website.
Sure. Yes, tomorrow, 4 o'clock, we offer a Welcome to Medicare webinar. We're going to go more comprehensive into what Chris said here today about all your options, and provide some other handouts that OSHIP can give you as well to help you get into the program. And we also offer virtual counseling appointments. So if our hotline, very convenient, but if it's not convenient for you, you can always schedule a virtual appointment at a convenient date and time. Through that website, or through the webinar, we offer a PowerPoint that includes that link, but it's also on insurance.ohio.gov. Can you go to the page of the extra help again so we can review those limits?
Absolutely. And we do have a brochure. We have a Medicare Savings Program brochure. We have a Medicare Part D and Extra Help brochure. Those are electronically on the website, or if you'd like an actual copy of that, contact our hotline. We can send those out to you. Again, we encourage anyone that's close to those limits, when in doubt, fill it out. We really do see a lot of folks saving a lot of money each year.
Great. You answered that faster. I wasn't quite ready. So if I'm going to keep working past the age 65, I've answered this a few times. Sorry, my mic is wonky. I'm still working, and I have active employer health insurance. Is there anything I need to do, or if I'm getting it from my spouse?
Yeah, no, well, we kind of used that exact example earlier. So if you're working past the age of 65, go ahead and enroll in Part A. You're entitled to it. There's no additional premium for it. It's likely going to sit dormant until you retire because it would be secondary to most group plans. Again, if there's unique situations or circumstances to you, contact us so we can do a deep dive into those. But generally, it's just taking Medicare Part A and then being prepared for when you or your spouse, if you're covered under their active employer coverage, when they decide they're going to quit, retire, walk off that job, whatever, being prepared to, at that time, enroll in Medicare Part B and likely Part D as well.
So do I change my MedSup during open enrollment?
Oh, we get that question a lot. Generally, no. Medicare supplemental insurance policies, they're not an option by themselves. They pay secondary. So we do see a lot of individuals that have original Medicare. They've selected a supplement, perhaps when they were new to Medicare. They may stay on that for a lifetime. This time of year, we're only really trying to evaluate Part D, the standalone plans, and the Medicare Advantage plans. Now, just a little bit more on the supplement. So supplements are kind of a little beast all of their own. They can increase their rates, but they're regulated at the state level through the Ohio Department of Insurance. So in order to have a premium increase, they have to show loss ratios to our department. And they can do that really at any time during the calendar year. So kind of to the same point, if you get a notice that your Medicare supplement plan is going up and it's gone up or getting to a cost that you can't afford on a monthly basis, that would be a great time to contact us as well. We can review the other supplements that are out there, and then you're welcome to make application for a new supplement at any time during the calendar year. You likely would have to pass their underwriting, or start investigating the Advantage plans as an alternative, perhaps for the next calendar year.
Can you talk a little bit about those drug discount cards that we see and how they might work?
Yeah, drug discount cards are just that, a discount card. And there for a while, everybody under the sun had their own drug discount card. The only thing I can really say about them, they are not insurance. So if you have a wallet full of drug discount cards and you choose not to sign up for Medicare Part D, if those discount cards are all you're relying on, if you sign up for Part D at a later time, you would face that penalty, 1% of the national average of premiums for every month that you delayed. Yeah, now if you have Part D and you have a discount card, you are welcome. You should ask the pharmacist, which is the best route. Maybe that discount card provides a huge savings on one of your prescriptions, and you can use that discount card for that one prescription and your insurance for the others. But the key message is the discount cards do not replace the insurance.
All right. First time this is brought up, but we've got time. Can you talk a little bit about health savings accounts and Medicare?
Yeah, it's interesting. These questions are phenomenal. Just how many tentacles there are in topics when it comes to Medicare. So a health savings account is typically offered by an employer. I know we have access to health savings account money you can put aside tax-free to utilize for medical expenses. And that works out very well while you're employed. However, you cannot have a health savings account when you're on and using the Medicare benefits. You can't contribute to those. So there are very specific IRS tax laws and timeframes as to when you need to get your Medicare Part A, and making certain that your contributions to that HSA have stopped at that point. But most employers are upfront and share that information. So an HSA, health savings account, money you can put aside tax-free for medical expenses while you're working. You cannot contribute to those accounts once you're on Medicare. Now, one good note, so we end on a good note there. If you have money in that HSA, you have to stop contributing, but you are able to still utilize the money that was in that account.
Okay. Lots of dental insurance. This is a good question here. So Part D, would that pay for my inpatient pharmacy? So if I'm hospitalized, do I have to worry about D there?
That's a good question. And actually, no, if you are inpatient, you're actually admitted into that hospital. That's a Medicare expense. So your health plan benefit is going to cover that. If you're in original Medicare and you were admitted, Part A is actually going to be covering that inpatient hospital stay, and Part B would cover all the provider services. It would not fall under Medicare Part D. However, if you are outpatient and you were not admitted into that your drugs would not be covered. So I would caution you, we've seen some exorbitant Tylenol given out at a hospital and other prescription drugs. You could even check to see if the hospital pharmacy is in the Part D network for those outpatient services. But inpatient, no, it would be covered by original Medicare or by your Advantage Plan medical benefit.
I currently moved to Ohio this year, and I'm covered under an Advantage Plan in where I moved from. What are my options?
Okay. Welcome to Ohio. So you do have options. Now, your Medicare Advantage plan is based on the county that you live in. And I always say we don't have little Medicare police monitoring when you move, but that does open up a window to change plans. So you are welcome to find a Medicare Advantage plan here within the state of Ohio if that's the route you would like to pursue. However, that is also going to give you a special enrollment should you want to go back to original Medicare and shop for, and I hit it too hard, and shop for supplemental insurance without medical underwriting. So you would have an option to go back to either original Medicare with a supplement, standalone Part D, or select a different Medicare Advantage plan. Generally, you have 63 days from the time that you move, but that would be really dependent upon when you notified Social Security of your address change for Medicare benefits.
Hold on, I'm having issues sending my last answer. What happens if you have a zip code that's in 2 counties?
Yeah, so we have had that. It typically defaults to one or the other. If it defaults to the one you're in, that works out very well. But we have had folks, have to go through, Social Security to verify that they are actually in that county so that they can join those plans. And it can happen. We're in Franklin County. We've got 60 plans. Licking County has 58. If I'm right on that county line and I want one of the 2 that aren't offered, I would have to verify that I am within those county limits. I think we even had one case where the county line went through their property. So we get into some in-depth counseling, but yeah, generally there's a default to one county, and if you're in the other, we can help you sort that out.
If somebody's called us asking us for an address to send us a new Medicare card, is that probably not legitimate?
No, yeah, and we went over the fraud very briefly. There's so much going on right now. One of the big things is this: you need a new Medicare card, and anything that brings against confusion is what they seem to target. We've had folks calling Medicare beneficiaries telling them that due to COVID, Medicare is issuing all new Medicare cards, and they need your information. Well, remember, Medicare is never going to call you. Second, Medicare doesn't need your information. They should have it. The only time you would ever need a new Medicare card is if you lose it and you contact Social Security or Medicare to get the new card. Anyone calling you about a new Medicare card is either trying to get your personal information for identity theft, or we've seen folks pushing Medicare Advantage plans. And the Medicare Advantage plan is the new card. They're actually enrolling you into insurance, and that is absolute improper sales tactics. So you would want to report that to Pro Seniors or to us at OSHIP. We share information readily.
And can you talk just finally here? So how would somebody go about selecting insurance? Medicare Advantage, MedSup, Part D? Can they use local agents? Can they do it over the phone? They get mail from brokers. What are all these people doing? Yeah.
You can do all of the above. Yeah, and I always like to point out, local agents, they're there for the long haul, right? That's their livelihood, and they know the local markets. You've got us at OSHIP. We're providing objective, unbiased information. There's no commission involved, believe me, whatsoever. You've got 800 Medicare to provide that objective information. The only thing I caution is a lot of times these out-of-state broker firms, I get them. I get emails saying, hey, we'll help you with your plan. And if you look at the link, it's taken me to this broker firm in Texas or Florida. They don't know the local markets. So please be very cautious of who you talk to, who you take your information from, and most importantly, do not share your personal confidential information with anyone you're uncertain of.
And
And
I
I
would
think,
reiterate that people shouldn't charge you if they're going on Medicare.gov and doing it.
correct.
I worry
Yeah.
about that a little bit. Yeah.
Yeah. And, you know, another thing, when in doubt, call OSHIP. Again, we're funded by Medicare. We physically sit within the State Department of Insurance to provide objective education, information, counseling throughout the state of Ohio. If there's ever a question, call us first. We'll do some investigating if necessary. But OSHIP's hotline, again, is 1-800-686-1578. So I believe we've come upon time, or do we have more time?
No, I think we're good. I think we got all these questions. They were all great.
I just want to thank everyone who took time out of their day to attend this. We greatly appreciate the governor's message, Director Judy French taking time to introduce our program, but to all of you for taking time to hear what was meant to be kind of the high end information about Medicare open enrollment, the extra help and fraudulent activities. I know we touched on so many different topics, but I highly encourage you, please take advantage of our other Medicare checkup webinars to go more in depth on all those topics. And for those of you that are new to Medicare, please take advantage of those Welcome to Medicare webinars. Our website also includes in-person events that we're going to be, so if you have a chance to come out and say hi, please do so. But with that, I want to thank everyone one last time. Thanks to our communication staff behind the scenes here that made this happen, and I wish you all a wonderful evening.